All right. Welcome to the Business of Aesthetics podcast. Super exciting guest today. Who do we have with us? Why don't you go ahead and introduce yourself for everybody who has not met you?
Yes, thank you, Lauren. I'm Prem Tripathi. I am a facial plastic surgeon in right outside the San Francisco Bay Area, and like you, I specialize in everything facial aesthetics, rhinoplasty, facelifts, as well as all the non-surgical treatments.
Awesome. We're so excited to hear about your journey. Our listeners are surgeons, med spa owners, people looking to get into the industry, also dermatologists, plastic surgeons. So you're a facial plastic surgeon specializing in everything above the collarbones. Tell us, you're a few years out of fellowship now. Tell us the route you took right out of fellowship. Give us kind of the nitty gritty of your path. And I know that you're getting ready to open your own doors here shortly.
Yes, I'm super excited. So coming right out of fellowship, we were in the sort of heart of COVID. So 2020 summer, I was done with all my training, and kind of hoping to celebrate that summer, but I couldn't go anywhere. And I ended up joining a aesthetics group that did not have a surgeon because because there was so much uncertainty, I had sort of considered going out on my own, but it wasn't the right time. So I ended up joining a med spa that wanted to bring on a plastic surgeon. And I was there for about 3 years, growing the practice. We expanded the practice by double, brought on the surgical arm, and I was doing, of course, the non-surgical stuff too. But now it is sort of time for me to do my own thing. And come end of this month, I will have a fully operational practice of my own. Not a surgery center yet, but a place that's all my own to do everything I want to do.
That is amazing. Also a huge undertaking. So when you joined um your previous job, were you the only surgeon? Give us kind of the makeup of what your office was.
Yeah, so this was primarily a med spa that offered injectables, lasers, some weight management and wellness. But the practitioners that had started the practice were they're part time, and this was sort of like their side gig or side hustle, if you will. I was the only surgeon, and I was the only full time person there. So not only was I brought on to kind of bring on the plastic surgery side, but also to grow the marketing, grow the brand, help the practice with sales and with forecasting and with hiring and firing and sort of everything, because just myself and the manager were the only people there full time. So it was exciting, and it's nice because it sort of equipped me with the skills I needed, and really the mindset I needed to start my own practice. But ultimately, you get to a point where you realize that sometimes you're not aligned exactly with a set of other people, and I think partnerships are hard. So it was a blessing, but I'm really excited to be on my own now.
Yeah, that's definitely getting to learn the ropes a bit in a setting that's very similar to what you're going to be starting on your own here. When you came on, did your partners know that you were potentially thinking about going off on your own eventually, or how did that all kind of shake out?
Yeah, I mean, I guess on a side note, Lauren, it is a sticky situation right now, just FYI,
Fair.
between between them and I. But I can elaborate a little. Yeah, I think the idea initially was for me to kind of come on and grow, and for us to grow together as as many partnerships sort of blossom. Um, you realize either quickly or within a few years that you might not have the same goals as somebody else. And so I think they're, from a hungry surgeon that's just starting out to somebody who's doing this as a side hustle, there can be a little disconnect there. So I think there was always maybe the thought in both of our minds in the back of our head, but it didn't really come to fruition until, a few years later.
So what is your new practice called?
So my new practice is Bay Hills Plastic Surgery. So it is right outside San Francisco, about 30 minutes away, but in an area that I think is really beautiful. It's a really nice foothill area with perfect weather and just a nice scenery. And I live 10 minutes away from it, which is even better. Um, and I think it really typifies just the area and the beauty of the Bay Area, because it's a really nice place to practice and a nice place to get treatments.
So, as someone from the Midwest, setting
Yeah,
up a practice in California seems so daunting just in terms of um, competition, whether it's
yeah.
friendly or unfriendly. Get if somebody's looking to start a practice in a highly competitive market, give them a sense of what made you want to do that. Is that where your family wanted to be and then you make the practice happen? Or was it an opportunity from a business standpoint that you saw? It,
Yeah, no, that's a good question. I mean, ultimately, after training, I'm California through and through. I spent only 1 year of my life, honestly, outside of California, and my family and my wife's family are all nearby, which is amazing because I have 3 kids. So a big push to find a place to live was that family support. I didn't grow up with grandparents, so I think it's really nice for my kids too. But I think the other thing to remember, at least for us in California, is in these big metropolitan areas like LA or San Francisco, there is a lot of competition, but that also means to me that there's a lot of patients that want these services. And it kind of pushes us as doctors, as providers, to really be the best, right? To push ourselves to constantly be evolving, to get all the training and the updated education that we need. So from the mindset part, I think all of us are trying to push each other to make each other better. And then at the same time, you kind of have to find your niche. I'm lucky that there are a lot of I have a lot of competition, but there weren't a lot of facial plastics people in there. There's a lot of plastic surgeons or dermatologists. There's lots of people that overlap, but there weren't a lot of people that focused on rhinoplasty or facial surgery. And so, despite the competition, I feel like I knock on wood, I feel like it's gonna go well because I have referrals from people that are looking to have their patients take the next step from aesthetics to surgery, and not a lot of people that exactly do what we do.
yeah, we're so niche. I think there's so
Yeah,
much value in being so niche, regardless of what industry you're in,
absolutely.
because that's what people end up knowing you for.
Yeah, no, 100% agree. And it is super niche, but it's a lot of fun.
So tell us about your team that you're going to be starting with. What have you filled any of those positions? Did you, are they all new to you? Are you bringing anybody with you?
Yeah, so I hired it was sort of serendipitous. I hadn't even put an ad out yet, but there was somebody in the community that approached me um, for a manager position, and I had been sort of kind of looking and keeping my ears open for a manager. And she is, I think, the right person in the right seat. I hired a manager who's also an esthetician, who I think is going to wear all the hats in the beginning, right? Patient care coordinator, esthetician, manager. But the nice part about the field is that I think as you grow, you can expand on your platform and on your staff, and and for me, I want all of the people on my staff to have a path towards advancing their own career and their own education, but also being very much part of that like mission and our goal. And so she fits it perfectly. I'm not bringing on anyone from my previous job, but I'm also quite lucky that the marketing person that I worked with is now independent, so he's going to be doing some videos for me on the side, which is really great too. So I think as the practice grows, and I hope it grows fast, I'm just going to bring on a bunch of people. But right now, I've got a solid person that wears is going to wear 10 hats. She's fine with that.
Yeah, it sounds like you found a great individual. And I think, I hate to speak for the both of us, but I think we're both part of a generation where hopefully we're going to treat our staff a little bit differently than probably some of the places that we've worked and trained. I think there's a real shift in kind of the cultural aspect of what we want our offices to feel like. um, you
Yeah,
know, and so, like you mentioned, having her, you know, her trajectory being a path that she can grow into with career advancement, I think that's so important. And giving people autonomy with their own job, it's something I try to focus on every day with my employees as well.
Yeah, absolutely. Like that was a big thing that I brought to my last practice. I really wanted, and you know, we were in COVID. It was sort of like the Great Resignation, right? But I tried to create a path for everyone because, of course, you know, people start off at a lot of people start off being that guest client coordinator, the front desk person, and nobody aspires to do that, right? So I created, you know, tried to create paths for everyone, and even with my new hire, her name is Kimberly. She's amazing, and she sorry, my 3-year-old. Um, yeah, I basically asked her. I said, "Tell me how much you want to make." Right? I was very clear. I don't have any non-solicitation, non-competes. I want if she wants to open up next door one day, then I would support her. I think you know there's room for all of us, and I want people to feel valued. And I mean, like, what am I going to do? Like try and bring her down 5 or 10K for the amount that she asked. I think people it just doesn't make sense, and I wouldn't want that for me if I was looking for a job or for my family members. So you're right. I do think that there's a big shift.
Yeah, that's fantastic. You mentioned a little bit about marketing, how you're gonna have somebody work with you part-time. I want you to talk about the marketing you've been doing. You know, you were one of the first surgeons that I saw on TikTok and one of the inspirations that I had to start making videos, and I know for my own practice, it's been such an amazing referral source. It's interesting hearing some of the older individuals at some of the meetings that we go to, just really don't have a good understanding about what opportunity social media is today. You know, it's basically free advertising.
Yeah, exactly.
So tell us, you know, give us, if someone, again, if they've never heard of you, talk through how big your TikTok audience is, how it's helped grow your other platforms, how you anticipate it's going to help you launch this new practice.
Yeah, no, I first of all, I appreciate that. Those are kind words. Um, you know, I started the social media. I mean, look, I think it's sort of like a requirement at this point to have a social media presence, but I also think that I started the social media part specifically because I wanted to dispel all of these myths regarding aesthetics, right? There just seemed to be so much misinformation, and it was spilling over into real life, right? It wasn't just like this thing that existed and nobody was asking about it. I would have patients ask me these questions that I thought like where could they possibly have come up with this? And then I realized it's come from social media. So so when I started it, it was really to dispel those myths. Of course, it's nice for the business, but it really blossomed out of that. I think uh, social media is a chance for your patients to get to know you before they meet you, and that's never been the case before. I'm sure you have patients that have created this sort of parasocial relationship with you, where they feel like they know you, right? And it's a little creepy, but it's nice for them to find you, and whatever language you're speaking, it resonates with them, which I think was the other important part. And the challenge with everyone, with all of us in aesthetics, is I think we're so worried about what people think, but also that what we're saying is not unique. But at the end of the day, the what you're saying may not be unique, but you haven't said it, right? People haven't heard it in your voice. So that really stuck with me as well. Patients have heard this before, but they haven't heard it coming from me. So I really thought, how can I get my message across and let people know that I do have a particular brand. I think that I'm very easygoing and I'm known as like maybe the honest person, and that's not a bad thing to be known as like the honest surgeon, the person that gives good advice. So that was sort of how it started. What I felt like from a marketing standpoint that really worked the best was having someone in house, like a full time marketing person to give ideas, shoot videos, like really understand the language that we speak, to set up the camera, just have everything going. That was super helpful from a brand building standpoint. And then I think from like a personal social media standpoint for building who I was, I just honestly said, look, I'm just going to set up my camera. I don't know how to edit, set up my phone, shoot for 30 minutes a day and just get what I could get in there. And you're right. TikTok has been absolutely transformative in every single aspect of my life, whether it's with brand partnerships, whether it's with company partnerships, whether it's with patients coming in the door, all the things that I track. And if you're not doing it, you really are doing yourself and your patients a disservice, because this is evergreen content. It can live forever, and your patients should be able to access that at any point. So, long-winded response.
For the person out there that's looking to grow their practice and that just thinks like, I'm already very full. My schedule's very full. I don't know how to hire a marketing person. I don't know how to make my own videos or market myself. Would you give them any advice or any first steps in terms of building their social media presence? Because, like you said, I agree with you. I think it's imperative. I mean, it's a necessity at this standpoint. But um, yeah, what tips or tricks would you give somebody?
Yeah, I would say the first and most important thing, and it sounds very cliche and lame, is the mindset part. Like, we all have to get over the fact that we are not good at social media, or we're not skilled enough. If you can do an injectable or a rhinoplasty or whatever, it's clearly requires a lot more skill than putting your phone in front of your face and shooting. I would say that the second part is, it doesn't need to be beautifully curated. Now we're lucky we live in an era where people actually want content that seems a lot more authentic and is just a person talking. And then the last part is the time commitment. I have this conversation a lot with people. Is, if you spent, 2 grand a month on ads, you have to work to make that money to then spend it. So you can choose however you want time, right? Time is, time is relative, right? What's considered expensive is might be monetary or time. But if I can generate the same amount that you would with ads by shooting for 20 minutes a day, that might be more worth it to me, but it might be more worth it to you to spend the money. So we just make time and prioritize the things that are important to us. So I think that is a huge, huge hurdle. And the other part is, it's better to be done than perfect, right? I think, have the content out there. No one's going to notice the little flyaway hairs that you have, or that your teeth are yellow, or whatever the case is, right? It's better to just have it and have it be done, because at the end of the day, we're aesthetic professionals. We're not videographers, and I don't think anybody expects us to have beautiful videos per se. We just get it done, get your point across, and then move on.
I think those are such great points. I think, we're all our own worst critics when it comes to like the way we look or the words we fumbled. But I think volume is king, because at the end of the day, the consumer is going to spend 7 seconds on the thing. And so you shouldn't make it perfect, because it's not going to be on TV as the Super Bowl commercial. Yeah.
Yeah, totally agree. And I think you do a really good job with your videos, because they feel very, like, I feel like it's a glimpse into your everyday, which I think is something that you have really done well. Um, and most people don't know, right? I think people don't see the struggle of starting a practice. Like, you really, like, you showed everything. Yeah, everyone got a glimpse into the good, the bad, and the ugly. Like, I've seen you cry on camera, right? So I mean, it's that level of authenticity, I think, is important for your patients, because now you're just more relatable to them, and I think people don't have that relatability with their surgeon per se. So and again, I think what you said is amazing, but some of the stuff is not unique, but it doesn't matter, because you're saying it, not another person. So yeah.
What are some of the big challenges you anticipate, these first few months after you guys open your new practice, Bay Hills?
Yeah, I think, honestly, I think the biggest challenge will be, how do you get new patients in the door without just, like, spending money on ads, right? I think that's, like, just like a practical way to think about it. And I think we all in aesthetics go through ups and downs, right? January tends to be a slower month because everyone spent all their money on presents. So I think the seasonality will shift things, but I think that you're obviously, that phrase, that your network is your net worth, right? The more contacts I can make and the more people you can meet can be really beneficial in times where you aren't necessarily going to want to depend on ads or social media. The other part is just consistency. I think we all have the right tools and the right ideas of where we want the practice to go. but it's like being consistent, not getting complacent, planning 3 months ahead, planning, your quarter or your year ahead. Because when things are good, it's great, but you don't necessarily disaster plan when things are going really well. So it's terrifying to start out at this point, right, on my own, but it's also really exciting. I think I just have to keep that momentum and that excitement. All of us have to do that when we're starting something new.
For sure. And I think if you look back on all the career achievements you've had, anything really that's worth attaining, it's scary and it's big and it's hard. I mean, even becoming a parent, it's very difficult, but it's also probably the most rewarding thing.
Oh, 100%. Yes. I, I agree.
What are some marketing mistakes that you've either made or you've had friends make or things that you are not going to do again?
Yeah. I think from a strictly like practical standpoint, what I've learned is that your clients really want to know you, but they also need to see certain treatments and certain things that you offer multiple times as opposed to you showing multiple different treatments once, right? So before, I think it was fairly typical to have an Instagram post, to have an email marketing post, to have an ad, all say different things. But to have them all say a similar thing in different platforms to me makes more sense. So what I like to do is have themes for the marketing for a week or two, right? For example, if it's lips, we'll do a post on lips, we'll send email marketing related to lips, we'll have an ad related to it, or we'll have a landing page related to it. That way it makes more sense. Your patients have the most exposure to that one topic, whatever it is. And then I would say the other thing is responding fast, right? I think, one reason why people think that ads don't work is that they're not doing the back end work of responding quickly and having those marketing funnels and really responding to patients fast enough and emailing them information packet or emailing them a video 2 days after they put in an inquiry. I think that being consistent with responding is also super important. That's a mistake that I frequently see. And then the last part is, and I I see this all the time, is just heavily discounting things. I think as doctors, as providers, we want patients to come in the door, but we also don't want to devalue the service that we offer because at the end of the day, these are medical procedures. So I hate to see like super discounted things that basically put the position back into the patient's hand to choose exactly what they receive. And if, obviously it's an open discussion, but you would never tell your doctor that you want a 200 milligram antibiotic and not a 500 milligram antibiotic, right? It's sort of our job to give you the best advice. And if you're honest, then your patient should trust you. So I think heavily discounting sometimes can just throw off that trust that you're supposed to be instilling in your patient.
1,000%. I'm so against discounts, like on every level.
Yeah,
I think it devalues our, you know, abilities as a provider. I think it gets people into that mentality that we're a bargain barn.
right.
I tell my staff, like, we are the Chanel or the Louis Vuitton. Chanel never runs discounts, right? Because it's not on brand for them. And so
Totally.
at the end of the day, every business decision you make has to come back to, is this on brand? Is this in alignment with our mission, our values, and our goals for our patients?
Yeah, 100%. And I think, look, it's great to reward your patients. It's great to add bonuses, and we have we have the events here and there. But yeah, you're absolutely right. I think there's a certain client. You can choose that if you want to be low ticket, high volume, or vice versa. That's really a choice of your business, and I don't think it's not wrong to choose either way. But I think as surgeons, we offer a very specialty service that, especially for surgery, you start discounting surgery, and it's a very slippery slope.
We're rounding out 2023. What are some of the things that you're excited for in our industry, whether it's technology, drugs, surgical techniques? What are the things that you're consuming right now in terms of education?
Yeah, I'm always consuming surgical content, and I think it used to be very domestic and now it's become international because I think there's some incredible surgeons internationally that are doing some wild things that look unbelievable incredible. So I'm trying to expand my horizons there because, for example, there's some surgeons in Turkey that are just really doing an incredible job that we all need to be learning from. The other part is the technology. I can't, it's so hard to keep up with all these devices that are coming out. And while it's important for us to have all the information, we also need the data and the results and a proper way to vet these devices because of course, a smooth talking salesman is going to walk in our door every day. And so I think it's important to have those relationships, but to focus very much on what our patients are asking for and delivering good results. That's probably, I'm guessing, your mission, but it's definitely mine. It's we serve and earn. Obviously, it's a two-way street, but serving comes first. So I want my patients to have the best reproducible, the nicest results. And I think that unfortunately will come with a lot of time and effort on our part figuring out what technologies to offer.
Yeah, I
And they
think
change
you
so fast. So that is something we have to,
you always want to kind of fall in the middle. You don't want to be the first to adopt something, and you certainly don't want to be the last.
yeah.
But our patients place so much trust in us. Sometimes it's a little daunting to think about, at the end of the day, what are you offering them? Um, to what extent? What kind of results are you promising them? Who are some of the more challenging patients for you to treat?
Um, I would say that the first challenge I think comes with expectations, right? I think most patients, a lot of patients will come in because they're happy with someone they know that had a particular result with a particular treatment, right? And setting the expectation that they may or may not get that result because they're a different person is super important. And setting the expectation with them that they may require multiple things to get the result that they want is the other part. So I think the setting patients with unrealistic expectations, that's a huge challenge. I would say probably in the last maybe year, I've seen more patients with truly uh, a need for psychiatric care. So not aesthetics, who they make our way into our office, and it really is our job as honest professional people to refer them away from cosmetic treatments and to psychotherapy or psychiatric care. So patients with like body dysmorphia or some form of that, who by the way are obviously like very sophisticated and extremely well versed in, and educated in this field. So um, those I would say are the most challenging. I think that there's ways to still build a really, really nice relationship and rapport and still see these patients frequently. But I would say that an easy way for us to do that is to make sure your patients are screened by everyone in the office before they see you, including you, but also to do a very simple thing screen. Like I have a body dysmorphia disorder screening tool in my EMR. So it's one question, and if they answer no to it, then you're good to go. It's a very high sensitivity rate for finding body dysmorphia. If they answer yes, then they move on to the next question. So, and as physicians, we are notoriously terrible at actually finding that. So, I do think that I talked to somebody else about this. 90% of our job is aesthetics, and 10% is truly therapy or some form of it. And so that, towing that line can be a huge challenge, I think, in our field. But it's one that I enjoy and I'm passionate about.
How do you take care of you? Opening a business is a huge endeavor. You mentioned
Yeah.
you're a dad of three. How do you find time to, fill your cup?
Yeah. When I do that, I'll let you know. I think the thing that has helped the most is just time blocking, right? Putting on my schedule that during these times I'm going to do this. So from 5 to 6, I spend completely unplugged time with my kids, playing, no computers, no TV, no phones, in another room, just like our time. And then from this time to this time, working out or exercising or something that I enjoy. I think it's challenging, obviously. Like we're type A. I think everyone in medicine has a certain degree of type A. And it can be disappointing when you don't stick to your schedule. But that's been the most helpful for me is just time blocking that stuff. Because I know that if tomorrow I set aside time to run, then I don't feel as bad today doing more work than I would if I didn't have that time planned out. but it's a work in progress. I mean, I have a ton of help too. Having a lot of family support and help is has been so huge for my mental health. And then the last thing I think is we're lucky in aesthetics and in surgery and this field to have some expendable income. And I really think outsourcing some of the things that we would normally spend time on, like dishes and laundry, I think if you can wrap your head around outsourcing it, it is life changing and it's worth the $20 to $30 that you spend per hour to have someone do it for you. I think it can be huge because then you end up spending more time with your family or something else that's important to you.
Yeah, those are all great things. I wrote them down. I'm gonna go try them tonight.
Yeah.
Okay, so if you are in the San Francisco area and you want to stop by Bay Hills, when is your official open date? Do you guys have that nailed down yet?
Yeah, so I'm seeing a few patients this month, but my official opening date for the general public is January 3rd, 2024. So that's slowly creeping up. And then starting December 13th, which is tomorrow, I am officially opening up the schedule for 2024. So I'll be taking my manager will be taking calls. And then the 15th is when our website goes live, where everyone can put an inquiry in and start booking. I already have a couple surgeries booked. I'm very lucky to have that. So this week is the time to get scheduled.
Go time. Well, thank you
Yes.
again for sharing all of your wisdom. We wish you all the best in these next few weeks to fill your January schedule, get that practice off with a bang. So, everybody, this is Dr. Prem Tripathi at Bay Hills in San Francisco.
Thanks so much. Thanks for having me, Laura. I appreciate it.